Good morning, students. Today we will continue competition number 3.1, and today's topic is resistant starch. First, we will discuss about a starch. Starch is a storage carbohydrate of plants. In our food, the main carbohydrate is also a starch. Now, starch is composed of alpha D glucose molecules joined together by two types of linkage, that is alpha 1,4 and alpha 1,6 glycosidic linkage. Now this type of linkage is digested by the enzyme called amylase, which is present in saliva and pancreatic juice. This, if you see the structure of starch, it has mainly two layers. Innermost layer is called amylose, which constitute 10 to 15% of the starch, and the outermost layer is called amylopectin, which constitute about 80 to 85% of the starch. The amylose is having straight chain helical structure which gives iodine test positive, whereas the structure of amylopectin is similar to the structure of glycogen, which is branched structure. As I have told you earlier, it is the main carbohydrate which is present in our diet. So diagrammatic representation, you can see amylose is having straight chain structure which has only alpha D glucose molecule joined together by alpha 1,4 glycosidic linkage, whereas the amylopectin is similar to the structure of glycogen, which has both alpha 1,4 and alpha 1,6 glycosidic linkage. Alpha 1,4 glycosidic linkage form a straight chain structure, whereas branching point is created by alpha 1,6 glycosidic linkage. The only difference between amylopectin and glycogen structure is that in case of starch, the branches are comparatively longer and space wider as compared to glycogen. Now coming to our today's topic, resistant starch. Resistant starch means the starch which escape digestion in small intestine by the enzyme alpha amylase and reaches the large intestine is called as resistant starch. The digestion of starch molecule is directly linked to the size of its granule or size of the starch molecule. Other factors on which the size of granule depends is source of starch, cooking and cooling. So on these three factors, starch size of starch granule depends. If the size of starch granule is more, then it can be easily digested because surface area for action of enzyme is more. But if the size of starch granule is very compact, then it cannot be easily digested because the surface area available for action of enzyme amylose is less. So this is the diagrammatic representation of various starch granules obtained from various sources like potato, wheat, rice, etc. When we cook the food, the size of starch granule increases. Therefore, on cooking, the starch can be easily digested. Also, due to cooking, the branches of the starch molecule get separated and therefore they are also easily digested. But if we cool the food after cooking, the starch granule size decreases due to a process called as retrogradation. Therefore, a starch molecule cooled after cooking is resistant for digestion. The main sources of resistant starch are oats, cooked and cooled rice, green bananas, beans, legumes, etc. Now, the effects of resistant starch. Due to presence of resistant starch in the food, it delays the process of digestion and absorption. Resistant starch partially digested in small intestine and reaches to the large intestine, and in the large intestine it is fermented by bacterial flora into small chain fatty acids, mainly butyric acid and some gases. Now due to this there is a laxative effect on our element GIT. Laxative effect means there is increase in the peristalsis movement due to formation of these various fatty acids in the large intestine, and this causes bowel movement faster, which is called as laxative effect, and so that therefore loose stools are formed in our alimentary canal. Now, importance of resistant starch or benefits of resistant starch in the diet. It lowers the glycemic index of the food. Glycemic index means after taking a particular food item, how much blood glucose level is increased. That is roughly called as glycemic index. It has some importance because this glycemic index is directly proportional to the secretion of insulin, and insulin secretion is directly proportional to the synthesis of fat in our body. Resistant starch, by lowering the glycemic index of the food, they decreases the insulin secretion and fat synthesis in our body. Resistant starch also improves the fasting blood glucose level and insulin secretion, so it is helpful for diabetic persons. It decreases the absorption of food from GI tract and helps in losing the weight. Resistant fat also decreases the LDL cholesterol level of the blood. LDL cholesterol is also called as bad cholesterol because it causes atherosclerosis, in which the cholesterol is deposited in the blood vessels. So resistant starch decreases the LDL cholesterol level, and therefore it helps in preventing the various diseases related to high LDL cholesterol level of blood. LDL cholesterol, as I have told you, it acts as a laxative effect, so it maintains the regular bowel habits. So this is the diagrammatic representation of rise in blood glucose showing the glycemic index. First two foods are there, both are consumed in the same amount, that is 50 milligram. But if you see in first case, there is sudden rise in blood glucose level. In second case, the blood glucose rises steadily. Now the first case, as the blood glucose is high, more insulin secretion occurs and more fat is synthesized. So this is about the resistant starch. Thank you very much.